This is Aaron Byzak, and you're listening to the Matt Balaker podcast.
Hello, fine folks out there. Thank you once again for tuning into the Matt Balaker podcast. It makes my day. And if you want to be really special, please like, subscribe, and encourage others to do so. I am pumped for today's guest because he's a mentor and a bodyboarder. He's received numerous accolades for his work in healthcare and advocacy, including 4 Emmys. He was on the San Diego Business Journal's 500 most influential list 3 times. He's an inductee to the Carlsbad Hall of Fame and the 3rd CHS alum to be on the Matt Balaker podcast. So please join me in welcoming Aaron Byzak to the program. How you doing, Aaron?
I'm doing great, Matt. Good to see you.
Good to see you. So 4 Emmys for healthcare and advocacy. What's the deal there, Aaron?
So earlier on in my career, I worked on a number of projects that we didn't have any budget for.
Okay.
And so at the time, I sort of had to teach myself how to write commercials, public service announcements, things like that, because there was no money and no one else to do it. And it just so happens that the first set of commercials that I worked on, which were actually around the prescription drug epidemic, back in 2008, we wrote them. So on the early kind of days of that being known publicly, those first commercials won 5 Emmy Awards. And I was.
So I might have short. Oh, okay. I didn't want to shortchange you. So and where did these commercials air?
So they aired locally and then on internet and stuff like that. And then what ended up happening was the commercials we made, because they were made for low budget, but they were of high quality and the messaging was very good. And so Partnership for a Drug-Free America actually ended up reshooting those commercials, and they use them still nationally. So what we were trying to do was drive home the point that the prescription drug epidemic was hitting not a population that you would immediately think, but rather it was mostly middle to upper income kids from bedroom communities. And so we were trying to effectively slap parents in the face and let them know that just because you live behind a gated community doesn't mean that your kids aren't susceptible to this.
You can be in Bel Air, but you have a medicine cabinet, so watch out.
And you have really good insurance, and you have elective surgeries, right? And you use a couple of pills, and the rest of them sit in the medicine cabinet and become, fodder for fun, so to speak, on the weekend with the kids.
Interesting. So I understand, Aaron, you work in healthcare, but you don't stick people with needles. So what do you do? What do you do then?
I'm not on the clinical side anymore. I actually work as a hospital leader down in San Diego County, and I specialize in external affairs, so marketing, communications, government affairs, and community engagement.
Yeah. So what are some of the big other affairs or matters that involve your time?
Well, a lot of my time is actually spent on dealing with media questions around healthcare, particularly in light of COVID and things of that nature. Anything related to the hospital that I work at, any kind of projects we're working on. I also do a lot of marketing. So if you're driving on the freeway and you see a billboard for our hospital, it came out of my department. Also all advertising, digital and print. And then on the community engagement side, we're heavily involved in our community with community outreach and partnerships and things like that. So I have a pretty extensive portfolio as it relates to that. And then on the government affairs side, really there's an unending list of ways in which elected officials can challenge your ability to operate a hospital, or also help your ability to operate a hospital.
How would you break down the ratio of help to hindrance when it comes to public officials and hospital care?
90-10 hindrance to help, probably.
And elaborate, please.
I think that the challenge is a lot of things are based on reimbursement. So what are you actually getting reimbursed for in healthcare? Mm-hmm. And can you afford to provide services in the areas where the reimbursement's really bad by making up for it in the areas where the reimbursement's halfway decent. And so what I feel like I do on the government affairs side of things is I try to protect us against the negative legislation and the bad ideas, and there's many of them, and try to help elected officials understand what the ramifications are of the decisions that they make. So I rarely actually ask an elected official to vote yes or no on something or to carry a piece of legislation. What I essentially do is I help inform them. I don't like to say educating them because that can be a bit condescending. So I just try to inform them about how their decisions will impact our organization, our ability to treat patients in the community, particularly those that are most at risk.
That's interesting. And, out of the tens, if not hundreds of millions of people that are tuning into this episode, Aaron, I would imagine a big chunk are elected officials. And you're obviously not going to educate them because you said that can be kind of condescending. But now that you have their ear, what's a point or two that you would like them to understand?
I would say that the best case scenario, and a lot of times, is for folks to do nothing on stuff and allow the healthcare organizations to figure it out, because oftentimes they do. But also that if you are going to, let's just say that you stand very strongly for providing, let's say, government provided health insurance for folks in the community, which we're not going to argue against. We think that's important for a segment of society that can't afford it themselves. But if you're going to hand out a card that says that they're insured, you should probably pay for it. And that's something that doesn't always happen. I think that what happens is people are very, very open to providing the idea of health insurance, but then it's a little bit more difficult when you actually have to pay for it. And so I would say if you're going to do something, you should probably have a way of paying for it.
Yeah, I think funding is generally an important component to most things.
Right.
Obviously I've known you for a long time, but I never really got the backstory as to how you got so involved with healthcare and healthcare management. What gives?
So I got involved in healthcare. Actually, when I was in high school, I worked at a little pharmacy in downtown Carlsbad called McDonald Village Pharmacy, and I worked there as a delivery driver. And what was interesting about that, I just did it to pay some of the bills at the house. I grew up in a kind of a bad situation. My mom was addicted to drugs and stuff like that. So I've always been contributing in one way or another financially to the house. I got this job and I worked for an independent pharmacist who owned the company. And my job was to work as a clerk in the pharmacy and also deliver medications to elderly people who couldn't leave their house or who were living in assisted living facilities. And I really credit that with me having a better understanding of the plight of the small independent pharmacist and sort of like the challenge against the big box sort of retailers of pharmacy. And then also I learned a lot about what medications were for. And so I would deliver these medications and I'd read the package and I'd say, oh, they're taking this for congestive heart failure. They're taking this for atrial fibrillation. And so what ended up happening was I was, working all types of jobs. I'd worked that job. I was working as a bouncer. I was doing, different things at that time. Being just kind of a big guy who likes to fight, that was kind of my thing.
They're like, you like to fight, deliver medicine to elderly people.
That's
it'll work
right.
out perfectly.
You can do two things at once, right? You don't have to be one or the other. And so I was picking up any job I could, and I'd gone to work as a lifeguard over the summer. So I was lifeguarding. And they said, if you go to EMT school and become an emergency medical technician, you'll make an extra $1 an hour. I said, wow, that makes a lot of sense. And so I went to EMT school and actually realized while I was in school that, oh, this is something that I would like to do. And it fit really well because I think a lot of people that go to work in emergency medical services come from challenging backgrounds. And so they're used to being sort of professional rescuers in their own life and in their own family. And they go into this, and I did that, and I found that I was sort of ahead of the curve in some ways because even though I was young, I had already had 3.5 years of experience of talking to elderly people and also knowing what their medications were for. And so when you walk into a person's home who's sick, and many of the patients that you would respond to on an ambulance are elderly individuals who are sick, you would already have an ability to speak with them, an ability to understand, like if they say, hey, I take Lasix, oh, okay, I already know a cascade of background, information that is likely to be true about them. And so that helped me be successful there. And the original plan was actually to be a medic, a firefighter medic for my life.
Mm-hmm.
And at the age of 20, I was diagnosed with a heart condition. And at the age of 22, I ended up having heart surgery for the first time. First time I had heart surgery. And I have to say that my experience as a patient really changed the way I looked at everything. Because I said, man, this sucks. It really is difficult being a patient. And they don't really listen to you very much, particularly when you're young and you have heart condition, because they just assume that you're lying, or they assume that oh, it's got to be some
he's on speed. That's what caused it.
Right. So it's got to be some easy explanation for why this is. And then the other thing was, around the same time, I was having experiences with my mom who had gotten clean and sober, but she now had cancer. And I had a grandfather in the VA system, a grandmother in the private health system, and then my sister, who's disabled and older than me, was in the community clinic system. And so I was helping them navigate all this stuff, and I just started to realize, like, wow, there's a tremendous number of inconsistencies in how healthcare is delivered, and really how health policy and how healthcare law is written and applied. And it's weird, but I got this fire lit inside me to study health policy, which is otherwise the most boring thing ever for most people. I've had people since then tell me, I really want to study health policy. I'm like, have you actually read health policy? Because if you read it and then you come back to me and tell me that you still want to do it, then we could talk. So I decided, about 3 or 4 years into my EMS career, to completely shift and go in a different direction.
And what was that direction?
Well, I had been asking a lot of questions. I worked for American Medical Response, which is a large ambulance provider, and I had been sort of taken under the wing by a local CEO for AMR. And I was asking him all these questions. I was just peppering him. And he said, yeah, you should go talk to the head of government affairs.
Like,
right?
Shut up. Stop annoying me.
Up, Aaron,
go to the head of government affairs.
Go talk to the head of government affairs. And I went to talk to him. And he said, I'll let you go with me on a lobbying trip locally to talk to our congressman's office. And I'm like, well, holy hell, let's go do this. This sounds like a plan. So he gave me a piece of paper to learn and learn the information. And then at the end of the meeting, I'll give you 5 minutes to talk about anything that you want to talk about. I said, great. So I learned the issue, which was Medicare reimbursement for ambulance transports originating in rural areas. Complicated, but important. And we went and we gave our spiel. At the last 5 minutes, I said, I am really interested in how we treat seniors in assisted living facilities and skilled nursing facilities. I feel like this generation, which at that time was sort of the greatest generation, World War II generation, I feel like we're throwing them away in these facilities. We're warehousing them. And what I was interested in was that I think that Medicare should do unannounced inspections in these facilities, because if you announce it, then they clean it up for a couple of weeks and they come in and they're like, oh, it smells great in here, and everything. And then
sweep
they leave.
All the roaches under the rug, make everyone smile.
And so I said that, and she was just kind of, interesting, right? And it was kind of like that. And on my way out the door, we were waiting for the elevator, and the door was closing behind us, and I heard her walk by, and somebody said, who is that? And she goes, just some EMT.
Oh.
And I'm like, oh, right? And I talked to my grandfather, who was this really influential guy for me, and I told him the story, and he says, well, is she right? I said, what do you mean? And he's like, are you just an EMT? And I said, no. And he goes, well, from her perspective, are you just an EMT? And I said, yes. He goes, okay, well, what is she not knowing? I said, well, she doesn't understand healthcare and how healthcare works. Right. Okay. Does she understand the business of healthcare? No. Do you? No. do you understand politics and policy? I said, no. He goes, well, then there's your answer. You need to understand the politics and the policy and the business of healthcare, and you mix it with your clinical experience, and then you're well-rounded, and you can't be dismissed when you walk into any room with any group of leaders. And that's what made the shift. And I literally just said, okay, I'm going to register for school. I was 24. I'm going to register for school. I'm going to go to community college, and I'm going to study political science, and I'm going to get an internship and work my way up in that. And then I'll go get a master's in business and healthcare, and then go work at hospitals.
Wait, so you all in one afternoon, you thought, I'm going to go to
honestly,
college.
It was over the course of a fairly short period of time. I said, this is what I need to do. I need to get formal education and professional experience in these other areas, because I already had a little bit in the clinical side. I needed to mirror that with these other pieces. And so I made the decision. And at the same time that I wrote these educational and professional goals, I started focusing on personal goals. And I said, okay, you're an EMT, you work on an ambulance. It's not hard to get dates, right? But are you dating to date, or are you dating for a purpose? Are you dating to find a wife? And if that's the case, who exactly are you looking for? And so it forced me to focus on exactly what I wanted in all these different areas. And the great thing about it was that it helped me eliminate options when things would pop up, because young people, we're all stuck in this situation where we're like, oh, shiny object, trying to figure out what you want. I want to study sociology. Oh, no, I want to study organic chemistry. Uh-oh, no, I don't actually want to study organic chemistry. I want to study communications or whatever it may be. And so it helped me remove the extraneous stuff and just get hyper-focused. And the dominoes started falling almost immediately because I could recognize opportunity. I mean, I met my wife the first day of school.
Wow. So, obviously your experience is non-traditional. Like lots of 18-year-olds are kind of funneled from high school to college because that's what they're taught you're supposed to do. Obviously there's risk of having that time gap from high school to college, but it sounds like in your case, Aaron, you came to a position where you're so much more focused and got more out of it. I mean, is this something you recommend for the masses, or did it just work well for you?
Well, I recommend for the masses that what they do is they take a really thoughtful, introspective approach as to how they approach their career and their education and their life. And it's hard to do when you're 18 because you don't know anything. You think you know stuff, but you don't actually know anything. And I didn't really even know anything at 24 when I made this decision.
Right.
I just knew more than what I had known at 18. I had had a lot of life experience, some of it extremely tragic when I was young. And that helped inform my perspectives on things, and then add to it the tragic experience of working on an ambulance and the things that you see there. But when you mix it all together but then you figure out like, oh, I haven't had anything that really motivated me until I found this thing. And it was based on those experiences that would never have happened if I'd gone straight to college. Yeah. I mean, I personally think that you should take, general education until you figure out what the heck it is you want to do. However, I think that most colleges are completely ill-prepared at helping young people figure these things out. It's one of the reasons why, on the side, I do a lot of career consulting and career planning work with people and those people are all ages. I mean, they're everything from high school to, people in their 60s who haven't yet achieved maybe executive level achievement and want to get there and don't know how to bridge the gap. But it's also, people from middle income, high income, low income, no income. I do these kind of trainings at homeless shelters. I've done them for people who are formerly incarcerated and things like that. And there's certain principles that apply across the board, and one of those things is, starting with introspection and saying, what is it that motivates me? Why am I doing this? And I already knew that at 24, I had it because I had these experiences. But most people don't sit down and formally really think it through and then write a plan, which is precisely what I did. And then I just executed the shit out of that plan.
Congratulations. So,
yeah, thank you.
When it comes to introspection, you seem to have a very tangible approach to it. It's not just one thing to brainstorm. And I think you're rare in that. With some of these people you've worked with, what are some tactics or practical approaches they can do to formalize their plans so they can get working on them?
Well, one of the first things I have people do is I have them write down what are the major events and decisions in their life that led them to be who they are today. Mm-hmm. And people start writing stuff down. And, and when you work with people who are, let's say, middle income or like early in their career, they say, well, I graduated with a 4.3 yeah. and I got a whatever on my SATs and I went to this college. But I work with people who have said things to me like, I was sold into sexual slavery when I was 6 years old.
Wow.
That's a pretty major life event, right?
I would say yes.
Yeah. And so, what we do is I try to help people understand that whatever their experiences, whether they be, bad from the outside or from the inside, right? Whether they be bad or positive, that all of them are learning experiences. And one of the biggest challenges I see is that there's a lot of people who have been through very difficult experiences in their lives, and they have a hard time understanding how those aren't anchors dragging them down. But rather, I try to frame it around them and say, they're actually benefits for you because you've seen how you do not want to live. You've learned a lot of lessons in that, including maybe that you're codependent, or including maybe that you're really bad at making decisions, right, in your life, or maybe that you have been around what I call cultural poverty when you grew up, or moral poverty, or economic poverty, or intellectual poverty.
What's cultural or moral poverty?
This is what I say. I say that when people talk about poverty, they think of it in terms of economics. They think, okay, I'm poor, therefore I live in poverty. It's like, well, that's one type of poverty, but there's cultural poverty where, let's just say that the actions or the social norms or the values of the people around you in your culture are not aligned with being successful. Mm-hmm. I grew up in cultural poverty where my mom was more focused on getting methamphetamine than taking care of the kids, or where, we were exposed heavily to pornography when I was a kid because it was prevalent and everywhere, or even in a situation, this goes into moral poverty where, let's just say that if you're beat or molested as a kid, that's moral poverty.
Sure.
The people around you are morally impoverished. Mm-hmm. And you are growing up in an environment of moral poverty, cultural, moral, intellectual. Are the people around you just stupid? Because sometimes that happens. Sometimes you're surrounded with just dumb people, right, who make really bad decisions. Is it educational poverty where maybe they're smart or they're intelligent, but they're just not educated, formally or otherwise, and they don't know how to navigate an educational bureaucracy and system, which keeps people down. Now, I give a lot of speeches at schools, and one of the questions I'd ask, and I did this down in San Ysidro one time. When San Ysidro, down by the U.S.-Mexican border, is primarily Latino, like 95% or so Latino. And I was giving a speech there, and I said, how many of you in this room have been told that you can't afford to go to college? And all the hands went up. I said, how many of your parents actually went to college? And all the hands go down. I said, do you know that if you're poor, you don't pay to go to college if you fill out the right forms? It's different if you're here illegally, right? There's a gap there, that there's a donut hole kind of in the policy that exists where people who are here illegally don't get financial aid through FAFSA and stuff like that. But if you're here legally and you're poor, they will pay you literally to go to college if you fill out the forms. And at the time I was working at UC San Diego Health Sciences, I said, do you know that more than 50% of the students at UCSD don't pay anything to go to college? And they're like, what? And I'm like, yes. this is because you and your family are educationally impoverished. You don't know how the system works.
Mm-hmm.
So what we need to do is remove those things and show you the path forward and get there. And so when it's all over with, I say, listen, if you're only financially impoverished or economically impoverished, but you're morally sound, culturally sound, intellectually sound, or educationally sound, you don't have that many problems. There's plenty of programs out there for you if you're poor. There's not a lot of programs out there if you're growing up around moral poverty and cultural poverty. You have to recognize that and break completely free from it. Sometimes geographically, it's like pick your ass up and move it over to another place
Get
where
out of
you're
here.
not surrounded by that.
Yeah.
And so, that is a speech that I give about that, or that kind of concept, is an eye opener for a lot of people who then look at it and say, actually, you know what? I'm not that impoverished
Mm-hmm.
because my parents treat me well. Nobody molested me when I was a little kid or beat me up. All we have is a lack of educational resources and money. And they're out there if I just listen to this guy or any one of the other people that are around at the school that might be able to point me in the right direction.
Yeah.
So I was just lucky enough that I kind of figured it out at 24, had my grandfather to sort of help me, think it through, because I had to break out of my own ego of like, who's this lady saying that I'm just an EMT? And it's like, well, she's totally right. You're just an EMT, and you need to become something more than just an EMT. Who can be influential in the development of health policy. And so I actually wrote like a mission, vision, value statement for myself when I was 24. And, my vision was using formal education and professional experience in 3 areas of healthcare delivery, politics and policy, and business, become a sought after, influential expert in healthcare government affairs and management. That's what I wrote.
And that's what happened.
But you have to execute the plan. And I call what I do ferocious execution. It's just, you're going to attack it with a ferocity that no one's seen. And when you do that, people do one of two things. They either help you get there or they get the hell out of your way.
Both
generally
beneficial.
Speaking, both beneficial. So that's kind of what I teach when I do career planning stuff and things like that.
Very cool. So you're obviously an active mentor, and you started Hazel's Army. What's the story there?
So I mentioned that one of the first things I lobbied on was my interest in senior citizens and what was going on with them in assisted living and skilled nursing. And early in my, I went to college and became an intern at a senator's office. And I was approached by our chief of staff at that time as an intern, and he said, "Hey, you seem like you got your head on your shoulders. Would you be interested in proposing legislation to the senator for his consideration?" I'm like, "Yeah." So I proposed legislation around that same exact topic. And he came back to me about a month later and he said, "Aaron, I got to tell you, this is the best proposal I've seen. It's so well researched. It's extremely well written." I'm like, "Oh my gosh, this guy's telling me this." He says, "Now let me tell you why we're not going to do it." And he explained the politics of why this particular senator at that particular time was not going to carry this bill. And so that was a bummer, but it was a learning experience for me.
Yeah. So why didn't they? Like, what's the story there?
There's a Republican elected official in the state legislature bringing a bill that would more highly regulate businesses. Okay. And so they were less inclined to do that. They're like, "Hey, look, the Democrats are already doing that. Let them do it." We focus on reducing regulation and things like that, even though they agreed it was a good idea because they knew that there was a problem. It's just the politics of it, and so
kind of party loyalty sounds like.
Right. And so it made sense to me. And so as time went on, I started to, kind of branch out and do communications and write op-eds and do all these things. And eventually kind of found my way I'd originally planned into hospitals and was more focused on hospital policy and Medicare reimbursements at the federal level, Medicaid at the state, and all these different things that were going on there. And I moved away from sort of a senior focus. That was until 2013. And in 2013, my grandmother, Hazel, who was a resident in an assisted living facility, died due to negligence and neglect at that facility. And I was the person that found her in very dire condition. Actually used my EMT skills to assess her, figured out what was going on. She had a broken leg, she had laceration, she had all this stuff from an accident that they caused. And she died 4 days after that. But in the wake of that, I said, you know what? This is bringing me full circle to what I was so focused on before. 12 years before I had started this sort of crusade, didn't get anywhere because I didn't know enough. I wasn't politically astute enough. But now, 12 years later, I was pretty politically astute and pretty connected. And so I created what I called Hazel's Army, which was sort of a loose coalition of interested people who would pursue assisted living reform at the state of California level in the legislature. And so it started off with me writing 4 draft pieces of legislation and then targeting them at elected officials who I knew would be politically aligned with the message I was selling, Republicans and Democrats, get them to agree to those bills and then bring them together as a coalition to pass them all. And it ended up growing into what they called the RCFE, Residential Care Facility for the Elderly Reform Act of 2014. We ended up carrying 19 pieces of legislation, and we passed and got signed into law 13 of them that year. And so what grew from this small kernel of an idea with the help of a lot of media, because I actually was able to secure a 3-day expose in the San Diego Union Tribune about assisted living facility deaths. And coincidentally, a similar thing happened up in the Bay Area, where a bunch of people at a skilled nursing facility had just abandoned everyone there. You may remember the story, and like a cook and a janitor stayed behind to take care of everybody. That got a lot of attention. So I brought the folks from the Bay Area, which are instrumental in legislation in California, with San Diego, and we picked up LA in the middle. And we were able to pass this legislation, and it was the most comprehensive reform in a generation in the state legislature.
Wow, congratulations. So I'd like to hear some of your mentee success stories. And, we don't have a ton of time, so we'll have to be selective, but, this is a chance to share some of the good you've done for others.
Well, I got a lot of great mentees, so it's hard to choose, but I have a young man. He's not as young anymore, but his name is Teddy, and Teddy originally came to me when I was head of government affairs at UC San Diego Health Sciences, and he came to work with us as a summer intern. And Teddy, he's a typical college kid, and he didn't really have a lot of direction and whatnot. And we brought him in to work on some really important projects for the hospital. And he got extremely interested in policy and politics and things like that. And he went back to school and just absolutely killed it at school. And so all of a sudden came back with a new fire inside of him of what he was going to do, and got involved with the community at his college. And then when he was getting ready to be done with undergraduate school, he and I worked together for him to apply to become a legislative fellow with the state legislature. And we were able to work on that, and he got that. So he became a legislative fellow and ended up working for elected officials in Sacramento, and moved his way up the chain of command and was doing really, really well. And then decided to go to graduate school. And, the truth is, and I don't know if I've even told him this, but, Teddy got waitlisted at the graduate school at UCSD. And I called the graduate school as a fellow UCSD guy, and I said, hey, you have a list there. It's a wait list, and there's a guy named Teddy on that list. He's on the wrong list. You need to put him on the admitted list. And they're like, what? I'm like, yeah, just take his name off that list and put it on this list. And they said, okay. They put him on the list, and he got into graduate school, right? So went to graduate school at UCSD and did an internship at the United Nations, which he got, which is a coveted United Nations internship. And, he's just been moving up in his career. and now he works for the San Diego Regional Economic Development Council and as an analyst, and he's doing really good, an analyst manager down there, and just was chosen as one of the top 50 Latino business leaders in San Diego County. So,
Wow.
this is somebody who at 18 or 19 years old was like most 18 and 19-year-olds trying to find their way, and with some support. And I've been convinced by one of my colleagues at work that what I do is no longer called mentoring, it's called sponsoring.
Mm-hmm.
I've become a sponsor where I do go a little bit above and beyond for those things. So Teddy's a good example. I have another mentee named Kyle who's just absolutely killing it. Kyle works at the Cleveland Clinic now, so one of the top health systems in the world. And he started off as an undergraduate at UCSD, and I was sort of assigned to him as a protege through the San Diego Organization of Healthcare Leaders, which is part of the American College of Healthcare Executives, of which I'm a fellow. And Kyle had big dreams, and he wanted to go to graduate school and study healthcare administration. And I said, well, let's do this then, right? And so we created a plan, and we did career planning and did the whole thing. And he ended up getting into the top 5 healthcare administration programs in the country. He got a full ride to go to USC. Went to USC, absolutely destroyed it. Graduated towards the top of his class. Got a great residency, administrative residency while in college, and then applied for fellowships at the top places in the country, including the Mayo Clinic and the Cleveland Clinic. And he was offered fellowships at both. And he chose Cleveland, and he was at Cleveland for a year as a fellow, and then finished that, and they just hired him as a manager at the Cleveland Clinic. And if you work in healthcare and you know anything about the Cleveland Clinic, that is a huge deal.
Sure.
A huge deal for a 26-year-old kid to be a manager of the Cleveland Clinic, now have his master's degree, no debt from it because he got it all paid for. And so he's uniquely positioned. And what's really interesting is that he's paying it forward a lot. He's mentoring young people and bringing them to me and said, hey, you want to co-mentor these people with me? I'm like, great, let's do it. So we're helping out other people. And the other interesting thing about Kyle is that Kyle and his brother both have a condition called Hunter syndrome, which is a genetic condition. And it's very challenging physically. And so Kyle has become an advocate for people with Hunter syndrome and rare diseases. And so he's profiled a lot and highlighted a lot for the work that he does. And they actually have a Hunter syndrome specialty clinic at Cleveland Clinic. And so he goes and meets with young kids who have that condition. And, he's just doing amazing work. And so, those are a couple off the top of my head.
Yeah, no, I mean, you're like the Coach K of medical mentorships. No,
that's right. That's the
your
goal.
tree has several branches and they're all growing. Well, what are you most optimistic about, Aaron?
Oh man, that is a good question. What am I optimistic about? Not the direction of the country. That's off the list. So I think that what I'm most optimistic about is how much control and influence we actually have on our own lives.
Mm-hmm.
And I'm optimistic when I see people who have come from really challenging backgrounds who suddenly have the light switch go off and they say, oh my God, I could totally do this. Like, if this dude can go do it, why can't I go do it? Right. And I really like that. It's like, listen, I'm a kid that grew up in a meth house in a Vadio neighborhood in one of the most beautiful coastal enclaves anywhere. Right.
Mm-hmm.
And so you have this mix of different influences. Had a lot of bad stuff happening when I was young, but I was able to acknowledge or recognize that I have a handful of capabilities that, if really exercised, could grow into capabilities that would allow me to dramatically influence my life, the life of my kids, but also the lives of other people who are around me. And when I meet people, particularly people who come from really difficult backgrounds, and they have that spark and they say, oh, I could do this too, I'm in. Like, hey, what do you need from me? Let's make this stuff happen and let's go for it.
Nice. So for the Teddy's and Kyle's and all other folks out there who might need your guidance or just want to learn about you, where can they go?
Best thing to do is find me on LinkedIn. So they could find me right on LinkedIn. It's Aaron Byzak, AARON BYZ as in zebra AK. And they could hit me up on LinkedIn, or they can find me. I do, side consulting through a company called Galvanized Strategies. And they can go to galvanizedstrategies.com, and there's an education and training section. They can click on the link for strategic career plan or any of the other things, and that'll get to me, and we can make arrangements.
Nice. Aaron Byzak, not just an EMT. Thank you so much for joining us today. We really appreciate it.
Thank you, Matt. I appreciate it.
Thank you for listening to this episode of the Matt Balaker podcast. To learn more, please check out mattbalaker.com and encourage your friends to like, subscribe, and share. Really appreciate it.